Now, we've been talking about this all morning long. Emergency departments at children's hospitals, they are bracing for yet another wave of respiratory illnesses to hit, with many of them just coming off an already hard-hitting wave of fall illnesses. So joining me now to talk about the dire situation in some of the children's hospitals right across the province is the Chief of Pediatrics at McMaster Children's Hospital, Dr. Angelo Mikrogianakis. Thank you so much for joining us once again.
Good morning, Tammie. Thank you for having me this morning.
No problem. Can you paint a picture of what is happening in your emergency department at McMaster?
The situation's actually across our entire hospital, and the emergency department is part of it. This year, we're seeing a huge surge of respiratory viruses that have returned after the last couple of years where we've been wearing masks and isolating. Now we're being exposed to all the regular viruses that we usually see in the winter months, but there's several years of young children that have never been exposed to these viruses before because of COVID and because of the protected things we did during COVID. So now we're seeing a lot more kids getting sick at the same time, and our hospitals are short from a staffing perspective after 2 years of dealing with COVID, and the child healthcare system, having been chronically under-supported and underfunded, is having difficulty keeping up with this surge. We don't have enough beds for the inpatient needs. We don't have enough staff to care for the patients that require high levels of care in our intensive care units and on our pediatric wards. And so this spills over into the emergency department because patients are waiting to get beds into the hospital. They're clogging up the emergency department. Our emerge can't work as efficiently as it's supposed to care for the patients coming to be seen. And so the stress is right across the hospital and right across our regions and our community hospitals as well.
Are you finding at McMaster as well? We've heard these stories about children not being able to get, let's say, an ICU bed and having to be transferred to another hospital that's just out of the city, not close to home. Is that happening as well at your hospital?
It's happening maybe a little bit more in our region. Our area around the Golden Horseshoe has grown exponentially in terms of young families and an active birth rate and young families coming to this area and moving to this area. And our children's healthcare system has not been able to keep up with the growth and with the demand. So unfortunately, as heartbreaking as it is, we've had children in our region who've needed our children's hospital, but we haven't had the beds, the ICU capacity, or the space to care for them. And unfortunately, they've needed to be transferred out of region, going long distances away from their homes and away from their families to Kingston, to Ottawa, to wherever an intensive care bed is available in the province. So children's ICU beds and children's ward and hospital spaces needs a reset and needs to catch up with the current demands of our population and our sick children.
Sick Kids just releasing some data saying that it looks as if there's a new hard-hitting strain of the flu that is on the rise and that RSV is on the decline. Are you seeing a similar situation at McMaster?
The viral pattern is very similar across the province. It tends to be more provincial as opposed to city versus city. So there's several respiratory viruses every winter. RSV is one of the main ones. Now influenza is taking over as the main one in terms of causing illness and children to be sick. So we are seeing a very similar pattern. And usually the winter viral season in pediatrics lasts until March or April as we go through all the viruses over the winter months. So what's particularly worrisome about this year is we've started earlier than ever, we're busier than ever, and more patients need us, and this is going to be a very long winter on the backs of a crumbling workforce that we're struggling to staff and keep up with demands of our patients and families.
Lastly, what would you tell parents who are concerned that if their child does indeed get sick, they may be getting substandard care in hospitals, not at the fault of the doctors and the healthcare workers, but just because of the situation itself?
I can assure you that our staff and our people are going above and beyond. I see every day how hard they're working and the lengths they're going to to meet the needs of our patients and families because they're so committed and they care so much. Families still need to trust in the healthcare system. We want to be here to support them. What we ask is that they help us by accessing healthcare at the most reasonable point of care. And so the children's hospitals need to focus on the sickest patients at this point in time. So when your child does get sick and you're looking for that assessment and that reassurance, and you want to make sure that this is a straightforward cold and there's nothing more involved or complicated, seeking attention as close to home and at the right level of the healthcare system, using your family physician, your pediatrician, the walk-in clinics in your area, the community emerge departments, so that the children's hospitals can continue to support the entire regions that they serve by being available and having beds and having staff available for those patients that truly get sicker in this time and require the specialty care available in the children's hospitals. So seek care close to home, use your resources, use the available access that's there. We know the healthcare system is tight at all levels, but that would help us in the children's hospital to be able to make sure that our staff is available for the sickest patients that need us.
All right, really good information there. Really appreciate you joining us as well this morning. That is Dr. Angelo Mikrogianakis from McMaster Children's Hospital. Thanks once again.
Thank you.